All righty. Hi, everybody. Good evening. My name is Esther, and thank you for coming to this episode of Sowing Seeds Mental Health Awareness and Wellness. Tonight, we have two panelists. I'll go ahead and introduce them, and then we can go ahead and get started. So, first, we have Dr. Chidima Achalonu. She is the immediate past chair and trustee for the postgraduate section of the NMA, which supports residents, fellows, and early career physician members. She is a pediatric emergency medicine fellow at Children's National Hospital in Washington, D.C. She completed her pediatric residency at the University of Chicago, where she also served as chief resident before transitioning to fellowship. She earned her medical degree from Morehouse School of Medicine, where she is actively involved with the where she was actively involved with the SNMA and continues to work closely with medical students through SNMA. Beyond her clinical fellowship, Dr. Achalonu also serves as the communication chair for the section on minority health, equity, and inclusion for the American Academy of Pediatrics and is a current scholar for the Emergency Medical Service for Children program, where she's working to optimize best practices for utilizing security and law enforcement in emergency department spaces through a trauma-enforced lens. Prior to matriculating to medical school, Dr. Achalonu earned her Master of Public Health degree from George Washington University with a concentration in community oriented primary care, and afterwards continued to work in the school health sector through health education, health promotion, and capacity building with Chicago, Washington, D.C., Baltimore, and Alexandria public schools. She earned her bachelor's degree in biology and psychology at Rutgers University in New Brunswick, where she served as a resident assistant, president of the NAACP, helped to recharter the MAPS chapter on campus, and was initiated into the Xi Nu chapter of Delta Sigma Theta Sorority Incorporated. Dr. Achalonu is most passionate about building community, reinforcing a diverse physician pipeline, and promoting best practices for the care of children, especially those from a vulnerable and marginalized population. So welcome, Dr. Achalonu. And last but certainly not least, we have Dr. Crystal Nwora. She is an adolescent medicine fellow at the Johns Hopkins School of Medicine. She is deeply passionate about advancing health equity, empowering young adults with chronic conditions, and mentoring the next generation of physicians. Dr. Nwora received her Bachelor of Arts in the Humanities at the University of Texas at Austin, Hook'em, and her medical degree from McGovern Medical School. She moved to Baltimore, Maryland to complete her dual training in internal medicine and pediatrics at the Johns Hopkins Urban Health Residency Program. In her first year of adolescent medicine fellowship, she earned her Master's of Health Science and Clinical Investigation at the Johns Hopkins Bloomberg School of Public Health. She's a recognized leader in diversity, equity, and inclusion and medical education. Her research focuses on the unique challenges faced by young adults with sickle cell disease as they navigate transitions in care. She is sharpening her clinical skills to become an expert in the delivery of high quality primary care to adolescents, young adults, and individuals with sickle cell disease. Welcome, Dr. Nwora. So, thank you both for taking times out of your night to talk to us about what mental health is, specifically its awareness and wellness. So, to start, I just have a series of questions, so anybody can chime in at any point of the night. And so, my first question is, as physicians and fellows, what was the moment in medical school or residency training when you first realized that mental health mattered just as much as your clinical skills?
The first time I had to study for an exam.
Yeah, pretty early.
So I think for me in particular, because I actually spent 8 years between undergrad before going back to medical school, where I earned a master's, and I worked quite a bit. So medical school was a tad jarring because I had very much fallen out of practice of being a student, and no longer kind of had those muscle memory skills of staying up all night and just focusing on things for 10 to 15 hours at a time, because it's just a different set of skills to work. And so I think that transitioning back to being a student, being away from home. I went to medical school in Atlanta, I grew up in New Jersey. So also being somewhere where I wasn't around a lot of friends and family, having to leave a city that I'd lived in for many years before going to medical school. I think all of that was really challenging. And so it really was like, as the the work in medical school started picking up, that I realized how important it was to not just know the knowledge to take the test, but really to make sure that I was setting really good habits around how I was studying, and being okay with not being the Chittima of undergrad who could function on 4 hours of sleep and still be a functional person, and recognize that I had seasoned. I was on the precipice of 30, and the body just doesn't do what it used to do anymore. And so while some of my classmates were doing all-nighters, I did not pull all-nighters in medical school. I did not have the capacity to pull all-nighters in medical school, and it just wasn't useful for me. So I think that was really, for me, the first point, is recognizing that to be successful and to be functional in medical school, I also had to be well. And to be well meant really defending the things that are important to me, whether it was travel, whether it was sleep, whether it was extracurricular activities that were not necessarily part of our requirements for medical school, but all those things were what allowed me to show up as a student in the way that I needed to pass.
I agree. I think the understanding like who you were in undergrad and then who you enter into medical school, I think it's a big transition. And I think honestly, looking back on it now, I probably had some maladaptive coping behaviors in undergrad that didn't show up until the intensity of medical school, where you're like, oh, the things that used to get me through are not sufficient enough to withstand all that I'm going through in medical school. And I think that was the first time that I actually like thought about words like anxiety and depression. And it felt really hard to like to see myself in that, because I'm like, no. Like I'm like high functioning. I can do all these things. I can make things happen. Like I am blessed to be in medical school. This is like a blessing. This is what I worked hard for. Like, what do you mean I'm struggling? Because for some reason I thought that meant that I was ungrateful, because, or I wasn't living up to my potential. And I think medical school was the first time I went to therapy. And like, actually it was like, oh, hold on. Like, it's not just I'm stressed about the test. It's like I'm stressed about the test, everything. I feel hyper vigilant. I feel this in my body in a way that I've never felt before. And I cannot function at this level anymore. And I think it really, for me, worsened around step one, which I was like, it's step one. Like, surely, like, this is the reason. It's situational, again, like anxious, and that doesn't fit me. And then it didn't go away. And then it started to change my eating patterns. Like I remember I lost like 1 or 2 pant sizes going through my interview season because I was just so anxious. I never ate, which was not like me at all. Like I was just avoiding eating and I was losing weight. And I just remember like having multiple times where I was like, yeah, I gotta talk about this. I've got to deal with this head on. Because it's like I said, if you don't have coping skills that are productive and healthy, you're going to cope in maladaptive ways, which add its own struggles in addition to how difficult medical school is just by itself.
Yeah. Thank you. And I think this is such an important topic to talk about in medical school specifically. Obviously, you all have gone through it. I'm going through it. We know how hard it is. And so, for someone who may not have those well adaptive skills of, coping mechanisms and dealing with stress, like what advice do you give to them? Where do you start in terms of breaking the chains of like maladaptive habits of, dealing with stress?
I think some of it's praised in medical school, right? Like, just like Jenna said, like, oh, like I stayed up all night. Like I can do this nonstop for hours. Like I'm not speaking up for myself. Like it was almost like a competition to be like, no, I'm the most dedicated and focused. And I think for me, it's like just reminding myself that like I'm a plant, right? Like I need water, I need sun, I need rest, I need nutrition. Like, am I meeting my basic needs, right? Because I can't be a great doctor if I'm not meeting my needs and I'm just like a wiltering plant. And so I think sometimes it's, what are the basics here? Are you sleeping? Just like I would tell my patients, like you need sleep. This idea that you don't need sleep and you can function off, even we can talk about call and all that stuff later, but like you need rest. And if you're not resting, you're not showing up in the way that you should be. And so I think sometimes going back to the basics can be helpful before thinking about this very creative plan as to how to address your mental health.
Yeah, I also think that some of that responsibility actually falls on us in this community of medicine. To Crystal's point, right, that some of these things are praised. And I think one of the biggest things that really breeds this maladaptive coping strategy is that we don't spend enough time talking about the hard parts of medicine. And so when you are that person who's struggling, you're like, your grades aren't where you want them to be, you're struggling with board exams, whatever it is, because there are so many points in you're struggling, you feel like you're doing something wrong or somehow you're not suited to be here because everyone else was able to make it through. And so I think as a community, we need to start actually putting word and speech to struggle and recognizing that medical school is hard. Residency is harder. Practicing medicine continues to be hard. Like every day of it is challenging, and there are struggles that we don't necessarily want to normalize, but we have to familiarize ourselves with so that people can find the language to talk about it. And in the meantime, while the larger population of the community is trying to figure out the language to do that, I think that finding really good mentors and being able to have those one-on-one conversations are so important. So I know that when I was struggling to get into medical school, when I was struggling with step one, when I was struggling with studying for my PEDS board. So again, like these are things that never go away, being able to have conversations with mentors and finding out like, I guess I'm not the only person who didn't pass one of their steps or who didn't pass a board exam or who struggled with shelf exams. And not to say that we all have to like trauma bond and share all of our struggles, but I do think it helps to say like, okay, well, when you were having this hard time, what did you do? What worked for you? And making sure that we all know that sometimes it actually is okay to not be okay. And the only way you can fix that is to talk about the fact that you're not okay.
And I think the point of when you are honest and vulnerable, one, you create space to create community, which I think is ultimate to wellness. There's so many dimensions of wellness. And I think an important part of that is how we're in community with others. But I think you can also do your small bit. And I think also there's like a structural part to wellness, right? Like just the structure of medicine, I think can be so cruel to the people that try to practice medicine. But I just think about like speaking to like the struggle around exams, talking to other people about like, I thought that I did my thing in undergrad, which I struggled in undergrad too. But I thought I was going to come to med school and do this. I need help. And then being like, I need help. When I got help, I was like, hey, y'all know that we got a learning specialist here that can like sit down and talk to you about like how to actually create a study plan. And then I told other people because I was like, hey, I was really struggling in this area. And there's this really great resource that I utilize. I want other people to utilize it too. Like, I don't want someone to feel like, oh, exactly, I'm the only one who's struggling around these like big exams or these hard moments. Like, we have an opportunity to like show up for one another when we are honest with one another. And again, so much of medicine is about like, you hustle so hard to get here. You don't want people to see your cracks. And the thing is, you can be really suffering inside trying to put on a good face because again, you're grateful to be here. You know how hard you work to get here. You know, other people, you like people looking for my downfall. I'm maybe the only Black person in this space. So I can't be the person who's off my game. I have to show up. And then we stop showing up for ourselves. So I think part of that is like being honest with other people because I think people want to help. I think there's a lot of people who are like, don't want to see you struggle and suffer and they want to be able to offer you something.
Yeah. Thank you both. Both of your gems were very high yield and very valuable. So thank you both for sharing that. As trainees, in your opinion, what were the toughest mental or emotional challenges that you faced?
How much time do we have?
Yeah, I was
like, because that list has legs. There's like a lot of things on it. I think that they're not like individualized things, like it's this and this and this. It's kind of how everything blends together. So I think the identity of being a trainee, particularly when you are a trainee so I went to Morehouse for medical school. And I think one of the more challenging things was transitioning to a space where like I was very fortunate where my first experiences of being a doctor or student doctor, everyone around me looked like me. So it was actually very normalized to be Black and to be a doctor. And then, you know, pretty much everywhere else that I would have gone for residency, except for the 3 PEDS HBCU residency programs, was going to be different from that. And so where I went for residency was very much not the same. I was quite lucky that I did have other Black co-residents, but the experience of transitioning to residency where now you're in an area where not everyone has the tools to understand some of the nuances of what it means to work with different types of doctors, whether it be I was in the Midwest and I am very New Jersey. I never felt more New Jersey than when I was in the Midwest, right? So whether it be like someone who's from the Northeast who now is like in this different geographic area, whether it be someone who's from a different ethnic background, from a different racial background. I'm in pediatrics, and anyone who knows peds knows that there's like a certain kind of personality type that is drawn to peds. I'm not that person. Like, I'm not short, I'm not high pitched, I'm not bubbly. Like that's not how I present myself in any sort of spaces. So I think that a lot of having to navigate a lot of those challenges and not even necessarily knowing they were going to come until like suddenly you're getting evaluations about things, or you're having these interpersonal conflicts with nurses or other doctors and things of that sort. Those are the things that really start making residency challenging. And then you add on 80-hour work weeks where, yes, the ACGME has done a lot to think about putting caps on how long residents should be in the hospital. But if we're being honest, they just stopped counting after 7 days. And so that's how the math makes sense, right? Like, I certainly had months at a time where I was working 14 days straight. And sure, in a 7-day stretch, when you started counting, it might have been 79 hours. So he was right underneath it. But I was doing that for 14 days. So it might be actually 152 hours before I get my next day off, which definitely wears on you. And we were a very call-heavy residency program as well. So I spent a lot of time in the hospital.
I think quite similarly, the structural challenges of whether it's medical school or residency create conditions where it's hard to be well. Especially with like this, the amount that you're working, the amount that you're studying, all the things that you're trying to do. And then like, let's add on top of the fact that like, you're actually like, these are people's lives, right? So it's not like low stakes, like, oh, like OChem, like, okay, like I made a bad grade. Not to say that's not stressful. I made plenty of bad grades in OChem. And it was very stressful. But I think there's also this heightened awareness that these are people's lives that we're entering in as a trainee and who wants to do the right thing. And sometimes that can keep you up. And then also I think medicine is hard. Like, I think we are interacting with people and sometimes the worst moment of their lives. And then you kind of have to pack up and move on to the next patient, right? Like that was that rounds. Or sometimes I don't know. There's just like so many memories where I'm like, what was challenging? What was challenging? What was challenging? What's challenging is being on call overnight and not knowing if you're making the right call. What's challenging is, talking to a patient that you spent a lot of time actually doing a lot of advocacy for, that they don't know it and they're just really mad at you and think that you are trying to fight against them and not trying to fight for them with their child. What's hard is having someone that you really cared for and worked really hard still pass away and having to break the news to family and feeling like, oh, wow, I'm going to forever be remembered in this family as a person who told them that like their loved one passed away. Like those experiences add up and add up and add up. And if you are working 14 hours where it's like, I saw this patient, this horrendous thing happened. Next patient, new face, new exam, like come in. This is their kid's biggest day in their life. And you're like, I just experienced 10 people's biggest day in their life without the opportunity to like always have an offshoot for that. It can be hard. It can be difficult. And then add on to medicine, we're moving a lot. Today's match day for internal medicine and pediatrics, which is super exciting for some people, right? But also these days are like, can be really disappointing for some people. And it can be really hard if you don't go where you want to go to, because maybe you really wanted to go to Northeast and now you're in the South and you don't have your community, your connection there. And so I think there's like a lot of moments that have really challenged my mental health. Like, Jim said, how much time do we have? Because I could tell. There are good parts, but like,
right. I was like, there are good parts too, but I think like the other thing that is really important for us to remember and like put language to, and I tell medical students and residents this all the time, is that medicine is one of very few professions where coming to work every day and doing your absolute best for every patient you see is actually the bare minimum of your job expectation. Right? It's particularly in academic medicine. You are supposed to be doing scholarship and institutional service and mentorship and studying like your own individual professional development and all of those things on top of documentation and other professionalism skills and leadership things and practicing medicine, which is this huge behemoth of a thing that we do every day. And so, one of the things that was really important for me in residency was just, again, like giving power to that reality and accepting the fact that that is hard. That is really hard. And what were the things that I could do to balance that out. And for me, it's become thinking about like which of my activities of daily living can I outsource? And we could talk about that forever. I don't know if we're about to get to questions about that, but like outsourcing activities of daily living so you have time to do the things that you want to do instead of being bogged down by doing the things you have to do, baby, that is #wellness.
I wanted to actually touch on something that Dr. Mora said, which is something that I personally don't know if it's talked about enough, is just coping with loss of patients, and not only the mental and emotional toll that it has on the family, but that it has on the person imparting that information. So, like, how do you cope with those emotionally heavy cases or patient losses, especially like early on in your career? Of course, I'm not, well, it may get easier, but I don't know.
I don't know that it when you have such respect for human life as physicians, like we take the oath to like do our best to preserve and to it's really I don't know that it gets easier, but I think you get better coping skills for how to manage it. We had I was really fortunate to go to a residency where we spent a lot of time thinking about our wellness, and we had a session where we just journaled, and the question was like, where do you take these patient stories? Like, what do you do with them? And where do we like where do they live in you? And I think it was a really interesting question for me. And like, how do I like take the stories of things that have happened? I think for me, like I'm a Christian, I'm a religious person. I think a lot of it's in prayer. Like I've been privileged to pray at the bedsides with families when they've asked, like, hey, like, do you mind? Like we're saying a prayer, like grandmother is passing away, and I've been privileged to sit there and just, be present in those moments. Um, I think there is like moments of silence. And so there was one attending that I had in the ICU, which I normally felt was one of those places where it's like something incredibly like sad can happen. And then you're like on to the next person because you got to manage the strip and then on to the next person. But he actually made it a point for us to have a moment of silence. And any like resident who was taking care of that person had the opportunity, if they were there that day, to like just say a couple of words about what it meant to serve and to take care of that patient, which I felt like was a really beautiful way of honoring life. In pediatrics, we often do honor guards for our patients who pass, which I felt was some of the saddest moments I've ever had in residency. But it was great to be there with other people who like with the nurse and with, the techs and with your tent. Like it was just nice to be present with other people mourning life. And so I think when I found moments to pause and acknowledge life was lost, right? Like we weren't able to do what we had possibly wanted to do, or maybe this was an inevitable outcome. We knew that this was coming, whatever the situation is. Sometimes just like pausing, and acknowledging that like someone died. Um, and like I said, I don't know that it gets easier. There are like several cases that come to mind that I can honestly like just sob very heavily thinking about how difficult it was. But I think for me, it is prayer, it is pausing, and then again, being for me again, just connected to a spiritual community, where I can just feel like I'm doing my service in humanity and I get to be in worship and talk about those things. And so I think those are some of the ways that I've coped with it.
Yeah, I would agree with that entirely. I too am religious, and so I think that prayer is super important. Therapy has also been important for me. I think that it can be hard because you don't want to trauma dump on your friends or your family, and many of them will not understand. And so being able to have like a good outlet to kind of process some of those things, of course, in a HIPAA sensitive way has been helpful as well. And then it really is, like to Dr. Moore's point, just like honoring the moment and just being able to feel it. So whether it is the moment of silence, whether it really is just taking a moment and actually being able to like let that emotion release, whatever that emotion is. Because there are, we see a lot of really beautiful things in the work that we do, and we also see a lot of like really horrific things. I share often, I think in pediatrics in particular, there is this like very unique cry of a mother who has heard that their child has died. No matter what language they speak, no matter what culture they are from, no matter what they look like, it is the same. It is this like guttural cry that haunts you. And so when you hear it, when you do this kind of work where like it is so unnatural, there's no word in any language language, right, to explain a parent who has lost their child. So like when you are in that space, like it's really important to honor that, to have those feelings, and to just allow a moment at least to process that before moving on.
And I think that it calls us to acknowledge that we are more than doctors.
Mm-hmm.
Like we're people.
Yeah.
Like we're people who are like, you know, like walking and living our lives as well too. And like we have feelings. And I think sometimes we have these superhuman expectations of ourselves. I think sometimes the culture has it of us. But we're human and we feel things. And when sad things happen, it takes a moment to like readjust, but we do.
Yeah.
But it, you know, I think reminding myself like a sad thing happened. Just like when there are happy moments and there are things where you're like, wow, like that scan came back negative. Like we are so excited. Today's the discharge, like discharging a kid who's been in the hospital forever. Like we are so excited. Like everyone's lining the halls to say congratulations. Like you're moving on to like, there are beautiful moments. And then moments you're like, I got to allow myself to be happy. I got to allow myself to be like, dang, we really pulled through for that one. The team did this. The patient showed up. The family showed up. Like, we did it. Like, so there also, as much as you're allowing yourself to feel those moments of grief, then you got to let yourself also experience like the joy of what we do, which there's a lot of joy found in our work.
Totally. Thank you both for sharing that. I think it's, like I said, I haven't been privileged to or privy to those conversations. And so I'm not sure just how much they're talked about, but I appreciate you both kind of shedding light on those scenarios that do come. But speaking of us being human, I'm not sure, maybe everybody experiences this. I know I do as a medical student, with that being imposter syndrome. Did you experience imposter syndrome either in your medical school training or in residency? And what are some things that kind of helped you silence or manage those voices in your head saying that you're not as good or you're not good enough? I know for me, a mantra that I honestly constantly repeat to myself is comparison is the thief of joy. But, you know, sometimes I can say that to myself, but still those voices are still coming. So how do you manage that?
You know, it's interesting. The other day, I was just having a conversation with someone, and they made a really good point in that, like, true imposters are so delusional. They actually have no qualms about them not fitting in and not having the skills to do what they do. And so when you are having those feelings that, am I good enough? Have I done enough? That actually is the antithesis of being an imposter, because you recognize that what you do takes work, takes practice, and you're always wanting to improve and be better. But like real imposters have delulu like we've never seen, and they know that they probably know somewhere deep inside they don't actually have the skill sets, and they're just going to do it anyway. And they're like, whatever, I'm fine. I belong here. I know exactly what I'm doing. And so I think that that perspective shift also helps to be able to battle this imposter syndrome, kind of taking the power away from it. They're like, in fact, it's not imposter syndrome. It's the humility of the work that we do, and like honoring the work that we do and the work that it takes to be in the profession that we've chosen to be in. And then again, you know, I'm going to bring this up so much tonight, but I really think that continuing to have really open and honest conversations about true experiences in medicine helps to deflate that as well, right? So some of that imposter syndrome comes from this idea that you are the only one who's ever struggled, that you are the only one who's ever felt that way. But when we are in forums like this, when we're in larger spaces, whether it be in the SNMA or the NMA, when we're having one-on-one conversations with peers, with colleagues, with mentors, with mentees, and we continue to create really safe and open spaces to talk about the good, the bad, and the ugly of medicine, the experiences we go through, the challenges we went through, I think it normalizes these feelings so that it no longer feels like imposter syndrome. And it really is just part of the comprehensive experience of this journey that we're on, which is this profession we've chosen.
I agree. And like being able to really get underneath like what is it that we're feeling, and not just, you know, just saying like I don't belong. It's like you do belong. Like clearly you don't just like, I mean, I feel like sometimes people slip through the cracks, but that's a separate conversation. But like you don't really slip through the cracks of medicine, right? You got to work your way to getting these things. You're constantly being vetted. So I did med peds, which means that I was constantly switching between internal medicine and pediatrics. And I think imposter syndrome, like med peds, like we go hand in hand, because you might feel like, okay, I did 3 months of peds and now I'm going back to medicine. And now you're like, whoa, y'all had 3 months of medicine. This is my day one, and I can already see the difference between us. And then you're switching back, and then you're like, okay, now maybe I've got a little bit of hang of medicine, but now you're like, dang, y'all got 6 months of peds. I've gotten 3 months of peds, and I'm still expected to do the same thing that you're doing, and you're constantly doing it. And I think I was constantly in this position where I was questioning, am I good enough? Do I know enough? When will this click? When will this like magic fourth year of med peds that everyone's talking about? Like, oh, y'all are the smartest people in the room. I was like, I don't feel it. I feel behind constantly. Two things I will say. One, learn how to decipher, use other words besides imposter syndrome. Because I think there were some times when I was just genuinely asking for like help. Like I don't understand this concept, or I do not feel comfortable and confident in this skill. I need assistance increasing my confidence around this skill, or I need help understanding this concept. And I think I would just label these feelings of unease and being uncomfortable as imposter syndrome. And I think it made it hard for my mentors or people around me to give me what I needed. And it wasn't always, sometimes it's reassurance, like, no, you actually do know what you need. But sometimes it's like, I need you to explain the coagulation pathway to me one more time. Because it's not like, I'm calling it imposter syndrome, like I don't belong. It's just, I just don't understand what's happening here. And I would love for someone to break it down to me. So I think sometimes we call things imposter syndrome because we're uncomfortable in a space. Take time to be really honest and understand, like, why is it that I'm uncomfortable? Is it uncomfortable because I feel like all these other people are smarter than me? Maybe that's imposter syndrome. Is it uncomfortable because I'm being asked to do a task that I don't feel comfortable and confident in doing? That's not imposter syndrome. You need to ask for assistance with that skill or with that knowledge piece. So I think that's one point. And the second point is, I think it's the 10-year anniversary of Shonda Rhimes' Year of the Yes book, which I read, highly recommend. And there is a story in it where she talks about, she loved Whitney Houston and she wanted to get hair like Whitney Houston. So she would do everything she could to her hair to make it look like Whitney, blow drying it, straightening it, dyeing it, all the things, until she told her hairdresser, she's like, I really wanted hair like Whitney Houston. And she's like, don't you know Whitney Houston's wearing a wig? And I think that story has stuck with me for so long, because sometimes we will beat ourselves up trying to make our lives look like other people, only to never realize that they are getting assistance in ways that we could have never imagined. Is it the person that is acing all of their exams in medical school? Do they have no debt to worry about? They got no dog to walk. They got no kids to feed. They have someone who's making all of their meals. They actually have been a tutor in this subject for their entire lives. And this comes really natural to them. Actually, they worked out in the field as like a nurse. And so like these skills are not actually brand new to them. And we are fighting ourselves trying to be like, I don't understand why I just can't be like her, not realizing all the other things that they may have had to help them get to where they are. And that's part of it. Like, you got to stay in your own lane, because I think sometimes it's similar to like what you tell teenagers about like Instagram. Like, people are showing the highlight reel. Like, she don't really drink that matcha and the protein powder all the time. She has some cheat days, but she's not showing you that. But you're going to try to beat yourself up for not being that, not realizing the full breadth of the experience. So it's easier to stay in your lane. I think imposter syndrome can go away if you focus on what you need and not what other people are doing.
We can end it right here. That was amazing, both of you, honestly. I think you're not only speaking to the masses, you're honestly speaking to me too, because I know imposter syndrome. Well, I'm not Delulu, so I wouldn't even call it that. But that's something that I constantly struggle with, especially in medical school with, counterparts who may not look like me, who may have had resources and experiences that I was not fortunate to have. And so as a result, we're already on different playing fields. And so just recognizing that, I think, is so important. And again, comparison is a thief of joy. Like you said, Dr. Nwora, people on social media show you the good side, but they don't show you the entire picture. And so you won't know unless you know. And so it's always good to just kind of, be in your lane, like you said. And Dr. Achelonu, something you said earlier that I actually had a question on, you mentioned mentors. So how do you go about finding mentors who prioritize wellness, and how do you initiate those conversations with those mentors? Not necessarily telling them, oh, I can't do this, I'm struggling, but rather maybe approaching it in a sense of, how do I get better? If that makes sense.
Yeah, I think finding mentors is it can vary depending on what it is that you want from the mentor. I think the first step is getting rid of this idea that we have that it's like one mentor is supposed to be everything for you, and instead having kind of a mentorship team. So I have some mentors who are really good at helping me think about just existing as a Black woman in medicine, mentors who help me think about optimizing the things that I do that are non-clinical and balancing that with my clinical identity, mentors who help me think about me, the physician, mentors who help me think about wellness, right? Who think about my next steps, all the different pieces of who you are. So really being able to like have a team so that that person that you are seeking out can be really specific and targeted in the support and the mentorship that they're giving you. And then also there's a separate conversation of like mentorship and sponsorship. And I think that as you have this conversation about wellness, sometimes not what you need is a mentor, but what you need is a sponsor and someone who can help offload some of the things that are causing you stress and anxiety by being able to fund your dreams or fund that next step so that it's not one more thing that you're worrying about. And so how then you go about finding those individuals varies as well. I think when you're a student, whether you're an undergrad, whether you're in medical school, it's kind of the last chapter of your life where you can just cold reach out to perfect strangers and be like, hey, I am a student and I saw you in this way, met you in this instance, and I just really admire the person you are. I would love to pick your brain more. Not that you can't do that as you move on in your career, just because it's a little trickier. But I think organically, those of us in this space want to reach back, and the logic of mentorship makes the most sense for a student. So medical students, undergrads, that's an easy way to do it. I think social media has opened tremendous doors as far as being able to help individuals identify mentors, whether it be on X or Threads, whether it be on Instagram. There are lots of different organizations that also are creating spaces to build community where you can find mentors there as well. So you have to show up and you do have to put yourself out there and then just ask for what you want. The very worst a person can do is say no. And then they say no. Like you don't self-implode, you just move on to the next person and it's okay. It's not a reflection on you. It may just be that they don't necessarily have the bandwidth to give you what you need at the time. It might be that they don't necessarily actually have what you're looking for. Like maybe you're actually not a good mentorship fit. And that's the other piece too, is even when you have found a mentor, it's being proactive in regularly assessing whether or not you're getting what you need and you are seeking out what you need as well. So maybe you have a mentor for a season. This particular person is helping me get through step. And then afterwards, the mentorship relationship does not necessarily have to continue because there was something very specific that I needed in that relationship and it moved on. So that's a really long-winded way to say that there's a dozen different ways to find mentors. You should use all of them, ask questions, but know that mentorship is a verb, like an active verb. So you don't just find a person and like, hey, help me. You sort of sit back and wait for them to pour the gems and the jewels into you. You do have to be very proactive in asking for what you need, in following up with them, and being able to find time to meet regularly. And, like any good relationship, it takes two people to build a relationship. And when one person is doing all the legwork, that relationship doesn't grow the way that it needs to. And so being a proactive part of that equation means that you get the most out of your mentor and your mentor can put the most into you.
I think from a practical perspective, because I think, and this is great because AMEC, it hasn't even happened yet.
Mm-hmm.
You go to AMEC, you go to NMA, you meet everyone, you're like, oh, I met Esther. And then they go up to you in person. They're like, oh my gosh, Esther, I would love for you to like mentor me. Can I get your email? You know how many emails I gave out the last time I was at NMA or at SNMA? And you know how people never followed up?
Never followed
I guess
up.
it's not to say like maybe they did all the legwork and they're like, Crystal actually isn't the kind of mentor that I'm looking for. But I think it speaks to the point that like, how many emails do you have in your phone? How many numbers do you have? People that you've collected that you actually never like followed up. And now that like I'm in a position where people are asking me for mentorship, I'm like, oh my gosh, did I necessarily make life hard for mine? Because they got no time for us to meet. I don't know what they want. I don't know who they found me for. They messaged me once and never followed up again. And it could have been I was on call. When I'm on call, my email, it just piles up. And so if I missed your email, it wasn't that I was like, man, I looked at that email and I didn't want it. No, it was like I legitimately like just send me a follow-up message or send me a message to begin with, or like present a couple of times that you're available. Make it as easy for me who has other things that I'm managing to say yes. And if not, a lot of times too, I'll be like, hey, I'm actually like, yeah, like I'm not the right person for that, but I actually do know someone or some resource that I can point you to. But sometimes you got to like really serve it up to someone. That way they can just take it and run with it. But if you're making me do that, then I'm like, dang, I got to find time. That's how many more hours I'm putting that off because that's a task I have to do. And so when you're asking for mentorship, sometimes you got to put in a little bit more work at the beginning, but it pays off dividends if you're able to like actually establish that relationship.
Thank you. And I know I am definitely guilty of collecting as many emails as possible and not following.
Maybe, oh man, like the undergrads and the med students, they're so eager and I love it. And I'm like, I can't help all of y'all, but the ones who rise to the top are the ones who serve it. I like that. Serve it up for me on a platter. And I will, yes. What do you need?
Definitely something to keep in mind moving forward, especially as AMEC approaches next year. So, in terms of staying grounded, what day-to-day habits specifically helped you stay grounded, whether that be in medical school during rotations or on tough call schedules as a resident or attending or fellow?
Well, I'm waiting for that attending check to hit. My answers.
I don't have an attending answer yet.
I won't tell you that I made it big, but there will be signs. There will be signs. I think things that I have done for me, movement is a requirement. Like movement and finding sunshine. So whether that is putting my face near a window, whether that is like physically, even if it's a walk, maybe I'm training for something, like having some type of like daily movement is just like a non-negotiable for me. Or even just like in a week perspective, like trying to say like, this is a really hard week, 2 walks, even if it's around the block, just something to like move my body. So cause sometimes in medicine, I didn't realize, no one told me when I was applying, like I thought being a doctor was gonna be bada bing, bada boom, and how much I'm just like literally typing, putting in orders. Like, so sometimes it's like physical movement is good for me. I think it is important for me. And I like did my best to do this in medical school and residency, now in fellowship, finding community outside of medicine. For people who are like, that is so cool that you learned how to read an EKG. Anyway, did someone else see like to people? Because I think sometimes we get in our heads and think our work is the most important thing ever, and that's all we talk about. And so sometimes just being around other people, like for me, that came through the other activities I was in, that came through my church groups and being in a Bible study, just like talking and being with people who aren't involved in medicine, like family, like that was great. And then I think I always tell people like call your people, call them. And sometimes that relationship feels like they're pouring into you, but call those people because they'll remind you who you are, why you're doing this, give you the encouragement. Like if you routinely call your mom, make it an effort to like call your mom, call your sister, call your family, like check in on people because then they can, keep that relationship open. Sometimes I think we get really myopic and we start to close things off when we get really stressed, and trying to force yourself to be in community with other people. I think those are some of my things that I do to keep grounded. And then I can talk about practical things on call if we want to recircle back to that.
I agree with that list entirely. I think that I am also a person who actually my closest friends are not doctors, and that is very intentional because it's important for me to remember that I'm a whole person, and medicine is what I do and I love it, but it is not all of who I am. And so when I want to disconnect from medicine and really unplug and regroup and refresh, it can be really challenging to do that when you're with other doctors because many doctors get together, like when 2 or more are gathered, they talk about medicine. And I was that person in medical school too, like really trying to encourage us to do that. So you can ask my med school classmates, I would be like, okay, guys, it's been about 20 minutes where we've been talking just about tests in class, like maybe 90 more seconds, we can get out our last purges and then let's find a new topic. I know that we've got other interests. There are other things we can do. So I think that is really, really important. I also, it's important for me to see the sun, but for me, it's preferably like seeing the sun somewhere where I got a passport. So in medical school and residency and fellowship, I think something that has been really, really helpful for me is planning ahead. So in med school, if we had, like, there wasn't a test on Monday and we had a weekend off, there wasn't anything going on, my classmates already knew. They're like, all right, Chidima, where you got a flight booked? Because I saw that 3 months ago and me and my little Southwest credit card and my points, had me a little domestic flight booked or an international flight booked, but being able to see ahead of time, okay, here's a space where I've got a little bit more flexibility and planning time to go visit family or take a vacation. In residency, our vacations were for like 2-week blocks. And so while it's also important to use some vacation time, sometimes like catch up on tasks that start piling up, I would always commit to having at least 5 device-free, work-free days. And again, you get your block schedule at least like months and months in advance. So I know I'm gonna be on vacation. So I'm looking at flight deals, I'm booking flights, hotels. It might be a group trip. I do solo trips, like whatever I need, but being able to see that ahead of time. And so I share often that I have been to 25 countries, some more than once, and 24 of them have been since starting med school. So don't let anybody tell you that you can't get out, you can't move, you can't travel, that everything has to be until you're done, because I went to 6 countries in residency, and that was during a global pandemic. So know that it can be done. It can be done safely, it can be done affordably, and it can be done still like within the constraints of really hectic schedules. And the other thing, I mentioned this a little bit before, but I really want to make sure we bring this up, is outsourcing activities of daily living. So as a Nigerian who was conditioned for certain things, maybe starting to use my dishwasher every week was a wellness move that I didn't even think that I needed, but not like letting go of some of those things that you're like, oh, I have to do it myself.
Or I should be able to.
Or I should be able to do it myself. My dishwasher runs 3 times a week, and I apologize to nobody. Okay. I hired a cleaner when I was in residency, which was super important. Now I'm broke because I'm a broke resident. So once a month, I would have a cleaner come. And that was really important to me because at least I knew like once a month, there was someone who's going to do like a good deep scrub. I could do the interim things, but someone was going to like clean my home from head to toe, light me some candles while she was cleaning. Maybe I would do a Peloton ride, things like that. So also being able to just like outsource some things that you don't have to do. Some people are really into like grocery delivery services or meal delivery services. That doesn't work as much for me, but whatever it is that it just needs to be done, but you don't actually necessarily care how it's done, as long as it's done well, just have somebody else do it, and it's totally okay.
Mm-hmm. That's definitely a good pro tip. So thank you for sharing. Something I wanted to touch on that you actually mentioned a bit that you're pretty good at, Dr. Achelonu, is setting boundaries with yourself, with the people around you. So specifically, how did you learn to set boundaries, whether that be with work, with classmates, or even yourself, without feeling guilty that, oh, my basket's piling up, I need to respond to messages on Epic or whatever? How do you learn that, or rather unlearn that you need to do all of these things?
I want to be clear, I'm actually not good at setting boundaries. It is what happens when those things start piling up that make me more intentional about putting those boundaries up. So some of it is just age. So I am no longer a spring chicken. I've learned a lot of things over the last decade on this journey in medicine, and even before medical school, because I did start medical school a little bit older. So some of it really was just life experiences. As you get more comfortable with just who you are, I think you become a lot more unapologetic about standing 10 toes down in that person, and the social niceties of, oh, I'm doing this because I want people to like me. Just it fades away a little bit more, which is nice. I'm just like, you can chew or you can choke. That's kind of how I feel people should engage with me. I don't know what to tell you. You're gonna get all of me.
I'm sorry, I never heard that.
No, I say that all the time. Someone once told me, they're like, you should put that on a shirt, because
I would buy it.
Because it really does sum it up, right? Like, you're not supposed to take big things whole, right? Like, you're supposed to either like pick them in small pieces, chew it up. But so when people start having issues with you setting boundaries, that's actually a them problem and not a you problem. And that's easier said than done. I know that. And so it's little boundaries. And first, it's actually the boundaries for yourself. So things like telling myself, all right, no, would it be really nice to go like a whole week or 10 days where you're not answering emails and you're just like couch rotting and watching Netflix? Yes. But also I know that my anxiety would build up if like I don't check my email, and what would come back to me after vacation. So it's having realistic 5 days. You got 14 days off. You can do whatever you want with 9 of those days, but for 5 of those days, you plan your time accordingly. So for 5 days, continuously, You won't check email, you won't do work, you won't do things. So it's setting boundaries for yourself. And then it's really not just communicating to people like, I won't do that, full stop. It's more explaining why this is difficult. Like, I am unable to do this because I have this like expectation or something I want to do. So I sing in my church choir, and when I'm doing my schedule request, for example, my boundary is that I really need to be scheduled. If I'm going to be scheduled on a Sunday, it has to be after 3 o'clock so that I can go to church and I can sing with my choir, because that's something that's really important for me to reset and feel whole during the week so I can show the best for my patients. So in a workspace, depending on who you're talking to, like being able to share your reasons also helps people understand. And sometimes it really is that I actually don't want to have to explain this to you, but this is where I draw the line. This is my hard stop. And I'm happy to talk more about this with you. I'm happy to find something in the middle that meets what I need and what you need. But like, this is my line and this is my hard stop. And just being able to defend for yourself, because only people get on your last nerves because you never stopped them when they got on your first nerves. So it really is important for you to protect your peace, because if you don't protect it, nobody will.
Mm-hmm. Yeah. And I think once you've proven, like, people like to work with capable, productive people. And so if you're a capable, productive person, I'm gonna just keep adding on to your plate because I'm taking it off of mine, right? And I'm like, oh, I don't have to worry about her. She's gonna get that done. 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 And I'm not thinking about how you're like, whoa, 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 I can't manage it, right? I'm not thinking about that because you've always proven yourself to be a capable person. So why wouldn't I add more things to you? And I think this sometimes happens with like research projects. Oh, we can add you to this research project. It's not gonna take that time. 3 years later, you're like, oh my gosh, like this is taking forever. Like, so I think one is sometimes in basket zero is not possible. Like, just you sometimes gotta detach yourself from that being a morality statement. And I used to feel like, oh, if I'm a good doctor, that means every single message in my queue, shout out to emergency medicine, every single message in my queue has to be answered. And now I look at it at like 4:30 and I'm like, these are the things that are critical. These are the results that I need to call. These are the patients that I need to respond to. Otherwise, that patient portal does say that I have several days to get back to you. And the paper that you were supposed to get signed, I work with teenagers. The paper that you were supposed to get signed so you could start playing basketball is due actually 3 days ago, but you saw me 4 weeks ago and you never mentioned it. And now you need me to turn that paper around. Like I cannot overextend myself like that. And I think by having some of those boundaries of like, it's okay if I go to bed and there's some messages that are unanswered because I've done the work that makes me feel good and satisfied. I've checked it to make sure that nothing was urgent. Same thing with emails. I've checked it. Nothing is urgent. It can wait. I can schedule that email. It doesn't actually have to happen in this moment right now. Other things that I've done to do, like, to put boundaries is like really getting comfortable with like saying, no, not now. Or can I sleep on that decision? Because I think sometimes we get really excited, like, wow, like they thought that I was going to be a really great fit for this committee. There's like a whole thing in academic medicine. People love to throw you in a committee, man. And that committee may not go nowhere. But you get really excited because you're like, wow, like you saw something in me that could be productive. And sometimes you just got to give yourself the ability to say, let me sleep on it. But that sounds really great. Can I get back to you tomorrow? And the more that you learn how to say, like, let me sleep on that decision, let me get back to you, the more you can actually give yourself the space to say, is this something that actually aligns with what I want that will get me to the goal? Or is this a distraction? And I did that with a research project. Someone said, hey, like, you'd be really great for the fit for this research project. It's just a lit review. It's going to take 8 or 9 hours. I'm like, surely I can find 8 or 9 hours. And I sat back and I said, actually, I've got like 2 or 3 other research papers that are in the queue. The 8 or 9 hours I could actually help me close out some of these projects. So I emailed them back and I said, I can't do it. Please consider me for other options. Or you start to think about like, hey, this might be a semi good for me, but I think there's someone else that might be like actually a really much better fit. So I think being able to like communicate that and learn how to like just slow, even if you're like, I don't know if I can say no, slowing the process to saying yes, create barriers to saying yes will help you create boundaries in your life, which I think is helpful.
Thank you all so much. Thank you so much. And I know we are running out of time. I just have one more question, if that's okay, which is, what is one practice, mindset, or belief that has contributed the most to your wellness? And in addition to that, what's one piece of advice that you can impart on our audience today?
Well, one I already said, and that is the piece about, look, I am who I am, and you can either chew or you can choke. And that is like a really important mantra to me because it it reminds me not to fall into the habit of trying to contort myself and make myself digestible to people if it's going to stress me out, if it's going to like break me down or add more pressure to me that I don't do. And so that shows itself in lots of different ways. That's the ability to say no when it doesn't suit you. It's the ability to be able to set really clear boundaries, the ability to unapologetically decide like, no, actually, I'm not going to do that, or I am going to do this because I want to do it and it's important for me to be well. But I am a whole person, and a whole person that shows up as a whole person in every space that I fill. And so that's really important that you not let these like small little nicks and cuts and, I don't know, mashing process that we're in that is medicine just mold you into a person that you don't recognize on the other side of it.
I think for me, it's funny because I remember like something that my mom said around like step one, which was like, you're not the first person to take it. Like, what makes you so special that like this is going to be like you can't get through medical school? And I was like a little offended. I was like, I am special, mom. Like, I'm your daughter, the firstborn. Like, I am special. But I think it's sometimes I get really egocentric in my anxiety, and I'm like, the whole world is revolving around me making this one decision or me doing this one thing, or like I am never going to be able to figure this out, and it's me, 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 me. And I think sometimes I just remember like, I'm not the first person to do this. Like, surely there is like a way, and it allows me to kind of like step back, look at a situation and say like, less spiraling, more problem solving, more level head. I am not the first person to do this. Like, I can figure it out. And then I think a practice that has been helpful for me, I already mentioned like exercise, but a practice I actually want to get back into, I was talking to a friend about it, is like actually some like quiet meditation. I feel like in medicine, we're always on and we're always responding to like notifications, and whether that is trying to get the research done or the scholarship or the committees or the patient notes, like we're always like, signals are always coming to us. And so intentionally spending a moment to be quiet and like being like, there are other things I could be doing, but right now I'm choosing to just to be quiet. And so in my clinic, after every afternoon, we actually like, I have like a gong and everything. We like take a deep breath, a couple of deep breaths together where we just are in silence before we start the busy, chaotic day of clinic. And it's just been a game changer. I'm like, breathe, serve, move on.
I love that. So thank you both so much for your time. Thank you for taking time out of your busy fellow schedules to come talk to us and just impart so much knowledge, valuable knowledge at that, something that I think everyone can take a piece of and practice that in their daily lives. So thank you all so, so much again. And thank you to our audience for watching. I hope everyone has a good night.
Thank you.
Everyone.